The new coronavirus continues to mutate, and vaccines are often delayed. The advantages of traditional Chinese medicine in terms of people-orientedness are highlighted. Today we will discuss a related report. Welcome to Harmonic Healing Channel. Today we discuss a report that combines ancient wisdom verified by thousands of years of practice with modern science, revealing the great potential of traditional Chinese medicine in addressing contemporary health challenges. Faced with the challenges of continued changes and new variants of COVID-19 and other epidemics, a comprehensive research report explores the unique advantages of traditional Chinese medicine in coping with this problem. The report focuses on new variants such as NB.1.8.1, which was first collected in January 2025 and has been listed as a variant under monitoring by the WHO with increased transmissibility. In California, for example, prevalence jumped from 2% to 19% between April and June 2025. Although the severity has not increased significantly, its rapid spread still requires strong countermeasures. The uniqueness of traditional Chinese medicine lies in differentiation and treatment. It does not target specific viruses, but focuses on the individual's overall condition and body response. Traditional Chinese medicine considers COVID-19 to be an epidemic caused by evil spirit, the impact of which varies depending on the strength of an individual's positive energy. Clinically, syndrome differentiation and treatment are used to distinguish syndromes such as wind-heat invading the lungs, cold and dampness stagnate in the lungs, or deficiency of both qi and yin in the recovery period, and prescriptions such as Lianhua Qingwen for treating wind heat and Shengmai San for replenishing qi and yin are used. The report also uses the theory of 5 elements and 6 qi to predict health trends in 2025, the year of EC. In that year, the metal element is not good enough, which means that the lung system is weak throughout the year. In the first half of the year, the Jian windwood is in charge of the sky, and wind evil is prevalent, which can easily spread diseases quickly. In the second half of the year, the Shaoyang fire is in the spring, and heat and inflammatory problems are frequent. This combination warns that in 2025, weakened respiratory systems will be more vulnerable to highly transmissible, inflammatory pathogens like the new coronavirus. Therefore, the report recommends that the TCM strategy for 2025 should focus on prevention, strengthening the lungs throughout the year, preventing wind and soothing the liver in the first half of the year, and clearing away heat and dampness in the second half of the year. The report mentioned that some people in mainland China sought help from traditional Chinese medicine when Western medicine did not work, reflecting the practical value of traditional Chinese medicine. But in the United States, TCM faces challenges in integrating into the mainstream. Insufficient official recognition, limited insurance coverage, and a lack of large-scale clinical research. To address these challenges, the report calls for a multifaceted effort. First of all, it is crucial for each of us to learn Chinese medicine for self-care. It is not just about knowing some prescriptions or treatments, but more importantly, understanding the core concepts of TCM and integrating them into daily life. For example, traditional Chinese medicine emphasizes that, when positive energy is within, negative energy cannot enter. The scientific connotation of this sentence lies in that it reveals the core position of the human body's own immunity. The so-called positive energy can be understood as what modern medicine calls immunity, resistance, and the body's self-repairability. When the human body has sufficient positive energy and strong vitality, it is not easy for external pathogens, whether viruses, bacteria, or other adverse environmental factors, to invade and cause disease. This is just like when a country has a strong national defense. Foreign enemies will not dare to invade easily. How to cultivate positive energy. Traditional Chinese medicine provides a specific path. Maintain a regular work and rest schedule, ensure adequate sleep, and restore the qi and blood. Pay attention to a balanced diet and avoid eating raw, cold, or greasy food so as to nourish the spleen and stomach and transform qi and blood. Insist on moderate exercise such as Vajra exercise, longevity exercise, Tai Chi, and Ba Duan Jin to unclog the meridians and strengthen the body. At the same time, regulate emotions and maintain a peaceful state of mind. Avoid excessive worry and emotional fluctuations that damage the internal organs. The practical value of understanding. When the positive energy is inside, the evil cannot enter lies in. It guides us to shift our focus from treating sick to preventing sick. Through active lifestyle management and health practices, we can fundamentally improve our health. This is the essence of the traditional Chinese medicine concept of preventive treatment. For example, understanding the core principle of TCM diagnosis and treatment, differential diagnosis and treatment, can help us look at health problems more scientifically and make wiser health choices. Differential diagnosis means analyzing and identifying the nature and characteristics of the disease at the current stage. Treatment means establishing corresponding treatment methods based on the results of differentiation. This means that TCM treatment is not simply treating the symptoms of a headache or the root cause of a foot pain. It does not target a single pathogen or test index with medication, but rather treats the person as a whole, comprehensively analyzing the individual's constitution, all symptoms, tongue and pulse, as well as the time, region, climate, and other factors of the onset of the disease. To judge the syndrome type of the disease. For example, for the same cold, some people may show wind cold binding the exterior syndrome, which requires pungent and warming to relieve the exterior syndrome, while others may show wind heat attacking the lung syndrome, which requires pungent and cool to relieve the exterior syndrome. Even if infected with the same virus, the symptoms may be completely different due to individual differences and different stages of the disease. If the public can understand the scientific connotation of treatment based on syndrome differentiation, that the occurrence and development of diseases are dynamic, and treatment must be tailored to the individual, time and place, they will be able to communicate better with Chinese medicine practitioners. Understand why Chinese medicine practitioners use the three-dimensional method of observation, auscultation, questioning and palpation, and why prescriptions are adjusted according to symptoms. Its practical value lies in that it can help us avoid blindly following the trend of using so-called miracle drugs, or using other people's prescriptions to treat ourselves. This ensures that treatment is individualized and precise, truly regulating the body as a whole and restoring balance. Therefore, the report emphasizes that individuals should actively learn these Chinese medicine wisdoms for self-care and seek help from professional Chinese medicine practitioners when necessary. More importantly, we should speak bravely to the Human Resources Department of your company and government officials at all levels to let them understand the importance of traditional Chinese medicine. Because, at a critical moment, this ancient wisdom may bring unexpected changes to the health of you and your family, or even save lives. Secondly, the report also puts forward more systematic and in-depth action proposals for the TCM community and policymakers, aiming to promote TCM to play a greater role in the U.S. public health system. In terms of public education and awareness raising, we need to use language that is easy to understand, to spread the knowledge of traditional Chinese medicine more widely, including its unique understanding of viral respiratory diseases and how to differentiate syndromes, as well as those prescriptions and auxiliary therapies that have been proven effective in practice. We should also share the successful experience of TCM in treating and preventing COVID-19. Whether it is rigorous clinical research results or credible individual cases, it helps the public fully understand the scientific connotation and practical value of traditional Chinese medicine, eliminate misunderstandings and enhance trust. At the level of policy participation and legislative advocacy, the report calls on the TCM community to take positive action and establish effective communication with lawmakers at all levels, local, state, federal, health officials and agencies such as the CDC. We should submit specific policy recommendations with the following core demands. First, promote traditional Chinese medicine, including the professional services of traditional Chinese medicine practitioners, the standardized application of traditional Chinese medicine, and therapies such as acupuncture. It has been formally incorporated into national and local public health emergency plans and infectious disease prevention and control systems. Second, significantly increase funding for clinical research on traditional Chinese medicine, especially for major public health challenges such as COVID-19, conduct more high-quality clinical trials, and use modern scientific data to prove its effectiveness. Third, strive for official recognition of the positive role and unique value of traditional Chinese medicine in disease prevention, treatment and rehabilitation, and clear obstacles to its development. In terms of promotion in workplaces, the report encourages every employee who values their health to actively make reasonable requests to the Human Resources Department, HR, of their company. For example, employers are required to support traditional Chinese medicine practitioners in providing convenient consultation and diagnosis services through telemedicine. This is particularly important in the context of repeated epidemics. At the same time, we will promote the inclusion of traditional Chinese medicine services such as acupuncture treatment and Chinese medicine consultation into employee health benefits plans or as supplementary insurance options. We can also explore providing certain reimbursements or subsidies for qualified traditional Chinese medicine prescriptions to reduce the financial burden on employees. Finally, in terms of insurance reform and practitioner support, this is the key link in whether TCM can benefit more people. We must use the World Health Organization's ICD-11 classification and coding of traditional medicine and the existing CPT codes for acupuncture in the United States as a solid basis. Actively lobby major insurance companies and the Medicare/Medicaid system. Our goal is to require them to significantly expand insurance coverage for traditional Chinese medicine treatments, especially for syndrome differentiation treatments for diseases like COVID-19, and to strive for reimbursement for prescriptions of Chinese herbal medicines. At the same time, we must advocate for fair and reasonable insurance compensation standards for the professional services provided by TCM practitioners, and promote more accessible and affordable malpractice insurance for TCM practitioners. To reduce professional risks and effectively protect the legitimate rights and interests of both doctors and patients. In summary, the report highlights the advantages of traditional Chinese medicine. Combining its millennia-old wisdom with modern medicine can help us better respond to health challenges such as COVID-19. If you found these insights helpful, please share your thoughts below. Your comments are valuable and help foster a community that thrives together. Also, don't forget to subscribe to us for more inspiring content. Let's stay healthy and live wisely. Thank you for watching.